Hello, my name is Erin Russo, and I would like to thank you for participating in my study for my Doctor of Nursing practice. It is my aim for this project to help make a positive impact on the mental health crisis that is impacting our adolescents and teens. Statistics from the Centers for Disease Control have provided evidence that there is an increase in mental illness in adolescents and teens. Nearly 50% of mental illness cases begin at age 14, and 75% will be diagnosed by age 24. In the age group of 13 to 18, 1 in 5 children will have or develop mental illness. Students with mental illness miss 18 or more days of schooling during the year, and we've seen the impact that can have during COVID. Suicide is sadly the second leading cause of death for teens and young adults, beginning at the young age of 10 up to the age of 34. Unfortunately, there is an average delay of 8 to 10 years which exists between the onset of symptoms and seeking help, with only 20% of children actually receiving help. One of the most difficult challenges is not only locating mental health support, but recognizing some of the signs and symptoms your child may be exhibiting, which are not the same as adults. Getting treatment for your child can prevent serious illness and prevent long-term mental and physical health issues. As the parent of an adolescent, it can be really difficult to wonder, is this just a stage or should I be worried? Puberty and development of self-identity can make recognizing mental illness a real challenge for parents and caregivers. Teenagers tend to be moody, they think they know better, they want to hide in their room as they learn their own self-identity. It is a steep period of development, growth, and transition into young adulthood. Children and adolescents don't display symptoms of mental illness the way adults do, as I mentioned earlier, as well as many of the symptoms of puberty can be confused with some of the signs of mental illness. There's also a huge stigma that still exists around mental illness, and it can prevent children from asking for help since they are embarrassed or don't want to be judged. And then the stigma can exist for parents who believe that they are providing the best care for their child and are fearful that if somebody finds out their child has any kind of mental illness, that they will be judged. In addition, adverse childhood events such as abuse can have a huge impact in seeking mental health, not only for children themselves, but if parents were victims of adverse childhood events. It can bring up painful memories, thus delaying addressing concerns with their child. Behavioral signs that you might be missing or confusing with normal childhood development include slipping grades or academic performance, sleeping too much, trouble falling asleep or staying asleep, increased nightmares, which they may not always share with you, changes in eating habits or excessive exercise where they may have anxiety about their body image, poor hygiene, withdrawal from social activities with friends or things they used to enjoy, and engaging in risky behaviors, which again may not always be easy to identify until it's too late. Children often present to their pediatrician or pediatric specialist with physical signs that you may have confused with other possible physical ailments. Some of these physical signs, which you might see, include low energy, chest pain or shortness of breath, which might be related to anxiety or depression, stomach aches, nausea or vomiting, constipation, which could be related to poor eating habits or lack of activity, frequent headaches, which often result in many missed school days and poor homework performance, periods of increased activity or energy, yet they're requiring less sleep. They might be hyperactive or acting up, emotional outbursts or aggressive behaviors, which can be easily confused with puberty and exercising their independence, as we often see with adolescents. And one of the more difficult things to notice might be behaviors of self-harm, including cutting or burning. And many children with eating disorders or those with self-harm attempt to hide it with larger clothing or covering their body with longer clothing, which might not be typical for the weather outside, which might be a good indication. I found this quote that I thought was perfect for this presentation, and it says, "Somatic symptoms are like a fire alarm, but without the smoke and fire. Imagine how distressing it must be to keep hearing the fire alarm and running for safety, only to find out you were never in danger." And so for adolescents and teens, it can be difficult to understand why they're experiencing these symptoms and worried that something greater might be happening and they might become scared. But if they were able to recognize their own mental illness or had parents or caregivers who could help them recognize symptoms of mental illness, then they might learn that these symptoms are part of their mental health. When should you consider seeking help for your child? Certainly, if their symptoms persist for a few weeks or longer and do not resolve, you want to be able to seek help from a licensed professional so they may help you work through the details of the symptoms and consider diagnosis. If their behaviors are causing distress for your child or family or their siblings, if their symptoms or behaviors interfere with their daily functioning at school, home, with friends, or after school activities and sports, or they stop going to the very activities that they enjoyed. You want to connect with school staff and see if they've noticed a change. Children spend a long time at school, and teachers may notice changes in their behavior, peer and social interactions, or symptoms of distress that you may not be witnessing at home, where it may be more of a safe environment. And then certainly if their behavior that they're engaging in is unsafe or they indicate that they want to hurt themselves, you want to seek immediate help. Having the conversation with your child about possible mental illness can be difficult. You may have experienced feelings of stigma related to mental illness that you yourself have experienced, or possible childhood events that were traumatic for you. It may bring up painful feelings. It's also difficult to try to figure out how to best help your child. Some strategies that can help you with this include choosing the right person. It may be that the child has a closer relationship or is more likely to disclose their feelings to a parent or a caregiver. And while that can be difficult for the other one, the important part here is getting your child the help they need. You want to make time for uninterrupted conversation and a safe space for them to speak. You want to listen without judgment or reaction. Oftentimes, children fear discussing their emotions or worries of mental illness because they worry about being judged and not accepted by their family. You want to ask open-ended questions to learn more. It can be hard to sit through silence, but allowing space for your child to process their feelings and emotions and put them into words can help you better understand what they're experiencing. And while it might be difficult, you want to try and not relate to your child's feelings. What they're experiencing through their adolescence and puberty is very different than what you may recall or be currently experiencing, and does not necessarily help them feel better. You want to remind your child that there is help and hope. As they're in the middle of feeling despair, it can be difficult to see that there is light at the end of the tunnel, and they can be supported by many people. Identifying a code word for your child to use when you're out in public or in social settings where they might be experiencing serious anxiety or depression, and they feel that they can say this word to safely leave the situation with you, can provide a sense of comfort. And certainly you want to provide positive parenting and a supportive environment with your family to help support their child through their mental illness. Knowing where to begin and seeking mental health support for your child can be overwhelming. It might be best to begin by identifying a licensed health professional who can help you and your child through their mental illness, or identifying if in fact it is mental illness that they're experiencing. It might be easiest to begin with your pediatrician or family practitioner, as they are now seeking mental health support for your child can be overwhelming and scary. You want to begin by identifying a licensed health professional. It might be easiest to start with your pediatrician, your pediatric nurse practitioner, or your family practitioner, and helping to identify symptoms and possible diagnosis, and then getting referrals. Psychiatrists or psychiatric nurse practitioners can help in treating mental illness with medications and diagnosis. A psychologist can help your child in counseling and working through their emotions and feelings and developing effective coping mechanisms and strategies. Also, you may want to consider a licensed mental health counselor, a mental health nurse practitioner, social worker, or substance abuse counselor, depending on the symptoms that your child is experiencing. Determining their availability, their experience with some of the behaviors your child is exhibiting, such as eating disorders, self-harm, or behavioral concerns like attention deficit hyperactivity disorder, might be best in treating your child with the expert advice and experience they have and their ability to prescribe if needed. You want to make sure you are able to cover the fees, or you have insurance coverage or mass health coverage. Finally, school-based staff are underutilized, and there is a huge shift in social emotional support of children and helping them be successful. Schools are the crux of support for mental health support in children. Adjustment counselors, school-based social workers, psychologists, or school nurses are all wonderful resources in helping support you and your child through their mental illness. Some of the greatest barriers to seeking mental health include costs, time, and accessibility. Finding time out of your busy workday, or being able to get there in between work and after school events can be really difficult to schedule regular mental health visits. One of the greatest resources that have come out of the COVID pandemic is the increased utilization of telehealth and online resources for mental health. It provides increased accessibility in terms of time and convenience from your home and not having to drive to appointments. It can be easier to schedule. It shortens treatment delays. Some of the most difficult delays include getting in to see a mental health provider. But you can begin by doing a consultation via telehealth and then go in for screening in person or seeing a mental health provider sooner. It helps to reduce stigma by going into an office in your community and there's concern that you might run into somebody you know. And this way it provides a sense of safety for the child or you. It improves communication because you're able to speak to your provider in the comfort of your own home, and you are able to communicate through patient portals if anything's changed or you feel like you need to see your mental health provider sooner. And certainly there's so many wonderful resources that have come out of the pandemic and even beforehand, both for parents and adolescents, including online resources and mobile applications that increase accessibility for adolescents to do in a space that they feel comfortable or if they're concerned about self-harm. Identifying and locating resources for mental health support can be overwhelming. I wanted to provide you some state and local mental health resources that are wonderful for parents and adolescents and teens to use. On a state level, Massachusetts has done a wonderful job in addressing mental health in children. There's the Massachusetts Child Psychiatry Access Program, which helps you locate psychiatric providers. The Massachusetts Association of Mental Health also provides resources and mental health providers. Massachusetts Behavioral Health Access for kids that are exhibiting behavioral concerns or issues. The Massachusetts Substance Use Hotline if you're concerned about alcohol or substance abuse with your adolescent or teen. And handholdmass.org is a wonderful website I found that provides support for both parents and adolescents in identifying and seeking treatment for mental health. On a local level, we have some really great resources in the South Shore of Massachusetts. Certainly, as I mentioned before, you want to consult with your primary care provider, pediatrician, or nurse practitioner. They can be one of the greatest advocates on your child's team. They can help identify resources and make appropriate referrals. And then again, school resources. Your kids spend a significant amount of time in school, and the teachers really get to know them and notice if there's any changes in their behavior or concerns. And there are really great resources being put into our schools to help kids with mental illness, gender identity, or sexual identity concerns. Bay State Community Services is part of the Department of Mental Health for Massachusetts. They provide mentors, family counseling, and family support, and community resources and social skills groups for kids. A new and wonderful resource here in Marshfield is JPH at Ferry Hill, where they're really working to address the mental health crisis in adults and adolescents. They have a wonderful adolescent wellness program I encourage you to check out. They've done a wonderful job as a nonprofit organization. If you are looking to get out of Marshfield and you're concerned about any stigma, the Plymouth Family Resource Center is close by. And then there are local mental health medical groups, including Dana Group Associates. They're out of Norwell, and they also have offices in Waltham. LifeStance Health, they have many locations nationwide, but some of the local ones include Norwell, Kingston, Plymouth, Weymouth. And then finally, Aspire Health Alliance is both in Marshfield and Plymouth. Again, if you want to seek help for your child outside of the town for fear of stigma, or your child's worried about being embarrassed if they're being seen in person. There are many national organizations and online resources that have become available both pre and post pandemic for parents and adolescents and teens in seeking mental health support. The National Alliance on Mental Illness is one of the largest organizations that looks to address mental illness all the way from childhood into adulthood and provides many resources and education. The Society for Adolescent Health and Medicine provides an abundance of information and toolkits for parents and adolescents to use, including apps and information and education. The Child Mind Institute, based in New York, has done a lot of neuropsychological work and research looking at behavioral concerns, attention deficit hyperactivity disorder, and learning disabilities. Brightline and Bend Health are both online mental health telehealth resources geared specifically towards children's, adolescents, and teens. Again, sometimes getting to a local provider, getting regular visits can be really difficult. So these great resources can be used to increase accessibility if it's difficult to get to appointments or your child just does not want to leave the home. Some additional resources on the national level and online include the Parents Helping Parents organization. It can be really stressful navigating through the adolescent, pubescent stage of development with your child. And certainly we need help navigating as parents through this difficult time of raising kids. With all the online technology that kids are accessing, increase in bullying, learning how to navigate that with your child can be difficult. And there's a wonderful resource here and crisis line if you're feeling overwhelmed or stressed and are worried about self-harm or hurting your child. The Trevor Project provides 24 hours, 7-day-a-week crisis support for LGBTQ plus youth. Teen Line is a wonderful resource for teens, and they are able to text the word teen, and they will get someone who will talk and speak or help counsel them through difficult situations. The JED Foundation is designed to help protect adolescent and teen mental health and suicide prevention, and encourage you to check out all these great resources and find what fits your needs best. In summary, I hope you've gained some increased understanding of mental health and seeking support early and the benefits it can have for your child. Overall, it will help to improve their quality of life and your quality of life. It will help to prevent poor long-term mental and physical outcomes. There can be a lot of comorbidities that go along with mental illness, including cardiovascular disease and diabetes and other physical ailments that can occur because of untreated mental health issues. The child will have better performance at school and activities, and as a result, build resilience and develop better coping skills through therapy and treatment, and able to develop skills that help them work through stressful life events. It will help to improve relationships with their friends and family and develop better social skills. And finally, more importantly, help to improve their confidence, self-esteem, and overall mood, which we know can be so challenging and a very sensitive stage of life for adolescents. A very important piece of information to include in this education is that if you or your child is in crisis, please call 911 or seek emergency services at your local emergency room as soon as possible. The 24-hour support on the National Suicide Crisis Lifeline is a wonderful resource, and they've just recently changed the number to make it more easy to access, and the number for them is 988. If your child is exhibiting behavioral concerns that are difficult for you to navigate, or you're concerned about their behaviors, the Massachusetts Behavioral Health Helpline is a crisis line where they have resources that will respond in cases of emergencies. And certainly you can call them outside of an emergency. Their number and website are here. Finally, I want to thank you for your participation in this study in mental health education. I really hope it's become a wonderful source of developing increased knowledge and understanding signs of mental health illness in your child that you may not otherwise recognize, and to help you to feel more supported in identifying and locating mental health support resources with licensed professionals for your child. I encourage you to please complete the surveys at the end of this education, as this is an important part of the study which will help to make a positive impact on adolescent and child mental health. I also want to remind you that coming up soon is the Children's Mental Health Awareness Week, May 6th through the 12th. Another term I've seen coined for this week is Mental Health Acceptance Week. And I think as parents and caregivers, this is important to remember, because not only can we be aware of our child's mental illness, but we must accept them and support them so that they feel loved and that we can help them get to their better selves. Thank you so much. Finally, I want to thank you for your participation in this study and education. I really hope that this education has helped you to recognize some signs of mental illness you may not otherwise recognize, and identify and locate mental health support resources with licensed professionals for your child and family as you help navigate mental illness with your child. Please do not forget to complete the surveys at the end of this educational intervention. It will be really important in developing education in the community and schools so that we can support parents and caregivers and navigating mental illness with their child. Coming up May 6th through the 12th is Children's Mental Health Awareness Week here in Massachusetts. I've also seen this week coined Mental Health Acceptance Week. And I think as parents and caregivers, it's important to note that not only should we be aware and recognize mental illness in our child, but to accept our adolescents and children and support them so they feel loved and guided through their mental illness and bring them to a place where they are well again.